Thank you for tuning into Bridging the Gap with Gifty NP, where we talk about everything from aesthetics to beauty to wellness to health to operating a business. So I truly believe that bridging the gaps, being it legal, professional services, taxes, I truly believe that bridging the gap and having a platform that discusses anything that has to do with aesthetics and specifically for this platform, bridging the gaps between being a nurse into being an injector or diversifying your skill set in nursing and having mentorship program and mentors that you look up to and people who are going to support you and help you and share what they know with you. Hello, hello, hello. This is Gifty NP with Aesthetic Love in Modesto. And today we are talking about minding the gaps. My guest here today is Ms. Marsha. And can you please introduce yourself?
Yes, I would love to. I'm Marsha Carter Hall, board certified nurse practitioner and owner and co-owner. Did we start yet? Yeah, you're good. Oh, I'm sorry. Co-owner of 360 Envy Aesthetics and Wellness in Baltimore, Maryland.
I like the name.
Thank
Envy,
you.
360 Envy.
Yes.
And Wellness.
Yes.
I love it.
Thank
360 is a good name. I like the name.
Well, thank you.
What inspired you to pick that name?
You know what? I'm so glad you asked me that. Originally, we were Quench Infusions and Wellness, and we started the practice just doing IV hydration and vitamin injections. And then we started adding on other services, and our patients started asking us for more, and we added on different things. And I had a patient that come to me and she said, "Can I just pull you to the side for a minute? I want to share something with you." I said, "Yes, of course, always." So we stepped to the side and she said, "I looked at my calendar and I saw you have an appointment tomorrow at Quench." And I said to myself, Quench doesn't fit anymore. It's not just IV hydration. It's not just vitamins. You guys have changed my life. A 360 turnaround.
That's amazing.
That was her exact words. And then she said, "Can I hug you?" I said, "Yes." I gave her a hug and she walked away. That night, I went to sleep. I woke up the next morning and I just got something that says you need to change the name. It's time to change the name. And we changed it to 360 Envy Aesthetics and Wellness because we are changing people's lives, a 360 turnaround. And the envy is not like a negative, envious type of thing, but it's more so when you change your life, you talk different, you walk different, and people start looking at you and they're saying, "What's going on with you? Where are you going? What are you doing?" type of thing. Yeah, that's how we got there.
You kind of want people to lean into the gains.
Yes.
I like that. Yep. I like that. So patients in this industry will develop a relationship with you that words cannot even explain. It's more like a feel. And I have come to really hold a special place in the lives of my patients and the patients that we serve. We started very small, and our patients continue to ask more, and which encourage us to step up and add more and to grow more and to be able to offer more. So this is such a natural evolution. Nothing stays still. Nothing stands still. Mm-hmm. So things are constantly moving and growing, and anyone who knows me knows I don't stay still for a minute.
Go.
I'm go. But that's just me. I've come to a place where I really enjoy what I do, where it's not even like working anymore. Mm-hmm. I enjoy my patients. And so that's awesome that's what like inspired you and inspired the name of your business.
Yes, thank you. Thanks for asking.
Nice. So let's talk about this. Tell me a little bit about what inspired you to go into aesthetics, a little bit background.
So honestly, I had a really traumatic experience, really, and that's really how I kind of got pushed into this side of nursing. And it was something else. I actually went to a medical spa in the Baltimore area,
Uh-huh.
and I just went for a traditional facial. I
Uh-huh.
never had a facial before. It was my birthday, and my partner was treating me to a facial.
Uh-huh.
So I went, and the facial experience was nice. But halfway into the facial, my face started to burn.
Mm.
And I said to the esthetician, something's going on. Is this normal? Because I
Mm.
didn't know what to expect. I said, my face is burning. And she
Okay.
said, no, no, you're fine. It's okay. I did a light enzyme and that may tingle a little bit because you never had it before.
Okay.
She steps out of the room. She's gone for 15 minutes. My face was literally on fire. When she came back in, I said, this cannot be right. I
Oh.
am burning. My face is burning. So she says, let me cleanse your skin. She cleansed my skin
Uh-huh.
and I had like second-degree burns on my face. She
Oh
used
man.
a lactic acid on
Oh,
my face versus the enzyme.
that
She grabbed it in
is.
the dark and my face was burned.
Oh,
It ruined my skin.
I'm so sorry to hear that.
It was a horrible experience. And honestly, I didn't trust anyone after that. And I went home. I cried. I couldn't go to school. I couldn't go to work. I couldn't do anything because my skin was ruined. And I said,
Oh.
this is crazy to me. And that I healed my skin.
Uh-huh.
I didn't trust anyone else to touch me. I started learning and looking to learn more about skin, which is probably why my practice is a little skin heavy,
That's
right?
awesome.
Because that was my experience. And yeah, that's so I fell in love with skin and healing it and what works and what doesn't work, and all from the trauma.
That's crazy. That's
Yeah.
crazy. So much education needs to be learned. So much needs to happen. Safety come first. That's why I always patients need to be educated on what is considered a medical grade skincare versus something that you can get um, over the counter.
Yes.
So even the depth of the esthetician who is touching you, and the room is lit and it's safe, and you've got to do your research. But you know what? Things happen as professionals, and turning the story into like a more positive and empowering,
Mhm.
I think is really, really awesome. And congratulations.
Thank you. Yeah, that was they say you're supposed to try to turn your pain and your experience to positive things if you can. So now I'm able to actually offer the expert knowledge that people need in a safe environment to help them, be okay with having a facial that's so simple.
Right, right. Gone wrong.
Yes.
That's crazy. So, second question for you. Has the aesthetic medicine evolved since you started your careers?
It actually has. It has. And I honestly noticed when I first started looking into aesthetics, I said, there's something happening here. There's a
Mm.
shift that's happening in the world where people are more concerned these days with aging and how they're looking and looking young and feeling young. We are all getting older every single day.
Of course.
And so I think because we're so social on social media, Instagram, TikTok, all of the things, that this is a big reason why the industry has grown so much.
Mhm.
But when I first started looking into it around 2018, 2019, it was
Uh-huh.
not as big as it is now. Yeah, so it definitely has grown.
But I think COVID was a huge shift in the industry. I have been in aesthetics since 2015, um, and leaning more towards the first 2 3 years, and then fully switched over to where this is all I do. This is all I do all day. And having been in right before COVID, coincidentally, we started our practice like plunged right into COVID, and just the need for people during COVID to, for the first time when we have to do Zoom, and that camera turn where we looking ourselves and seeing how other people see us on Zoom meetings. And I truly believe like that elevated this industry to where people are more asking like, what is happening? What's happening to my skin? What are other people seeing when they're looking at me? That really changed the way we look at ourselves and the way we look at our appearance to other people for that matter. So yeah. Yeah.
I agree. I think looking at Zoom, looking at the camera, looking at yourself for 8 hours, you're like, what in the world? You start to notice all the things that you probably weren't really paying too much attention to, you know? And so, yeah, I would agree with you.
That's awesome. That's awesome. Second question. Can you share some common misconceptions about aesthetic practice, external services?
I think a common misconception with aesthetic services is that you're going to look fake or overdone or not real or something like that. Like I hear that a lot from some of my patients.
Mhm.
They're so fearful of that. Now, depending on where you go,
Right.
that is different. Like,
Yes.
one injector may think it's okay to put two syringes in one person's lips.
Mhm.
Someone else may just only start with the one, and it's because they don't want you to have that big transition, and maybe it's not even needed. So I do feel like that is a big misconception because everyone doesn't over treat.
Absolutely. Absolutely. And I've seen that in my area of practice and over time when this is where patients come and they ask for specific things. It's very specific. They want lips, they want smile lines, they want cheeks, they want jawline, and having to sit down during your consultation process and be able to provide the education and be like, it's a great idea, but on you, I think let's let's kind of scale back a little bit. And personally, I do one syringe at a time, and I educate my patient as far as this is going to be a step by step process.
Hmm.
And I don't like my patients to look overdone. I am more on the natural side, on trying to just smooth the edges, and I'm not shy to, if a patient pinpoint a specific area, I'm not the kind to just do it. I
Hmm.
take the opportunity to educate, and more like in my practice, I like to coach my patients by saying, I am your girlfriend. I'm your girl. Okay. This is how we're gonna age, and we're gonna age it that way.
Hmm.
I would love to be injecting you 10, 20, 30 years from now. And therefore, let's do this together. Let's start with toxin, and then we're going to switch over to doing fillers. There'll be a time for the smile line. There'll be a time for under eye. There'll be time for cheeks. There'll be time for jawline. There'll be time for temple. So, and then when the time comes for facelift, I am not shy as far as setting the expectation and being like, this is what injectables can and cannot do, and
Hmm.
knowing the scope of practice and the limits, and setting realistic expectations, and having a patient understand that this is not a one-time deal. It's a process, starting with Botox, of course, skincare.
Hmm.
Skin always wins. So I'm really honored to be sitting across from you and your story and how you switched that from that situation into where you actually at the forefront of doing holistic skincare, which is awesome.
Thank you.
Yeah, yeah. So congratulations on that.
Thank you.
Um,
I enjoy it. I do.
yeah,
It's nice. It
yeah.
doesn't feel like work either. It doesn't.
Yeah, no, I love building my team. There are things that I love to do and things that I don't love to do.
Right.
I can inject all day, but the business side is something that I delegate. Yes,
Give
yes.
that to somebody else.
That's somebody else. Yes, yes. So, next question: what are the key consideration for patients um, contemplating injectables?
So I feel like the key considerations for patients would be if they're actually ready to actually be injected.
Really?
Because I honestly feel like that uh, people don't always know what they're getting into, and not to
Okay.
say that it's a bad thing. It's fine because I like doing it, and my
Uh-huh.
patients they enjoy. But I feel like that people need more education of what it actually means to be injected. Like what is happening, what is the benefit, what even what is the risk. That's important. Um,
Absolutely.
do you need tox or do you need fillers?
Yes.
Because I can't tell you how many times people come in and they're like, oh, I need tox right here. And they're pointing to their cheek. And I'm like, that's not where tox goes. I mean, it could, but you mean, what's wrong with it? Oh, it's so flat. I lost 50 pounds. It's flat. I'm like, that's filler. So just a little bit of education is what I mean by letting them know what they're getting into.
Absolutely.
That's just my take on it. What would you say?
I would say timing. The question everybody have heard about baby Botox, and when patients come in, should I get Botox? Should I get fillers? Is it a good time? What am I getting into? Is it something that I have to do all the time? What if I don't like it? Am I going to be judged? You know, so there's a lot of vulnerability. I mean, when it comes to appearance, and as we all know, we live in a very youthful, we celebrate youthful, and it's great to be youthful. But more than anything, personally, I believe 360 health is more of my goal. You want to be healthy, not youthful. And so I have taken a lot of courses in biohacking, which is a topic for future discussion with peptides and anti-aging. That's a whole movement that I'm excited to be able to dabble into it more and learn more as my practice grow and I add providers. I'll be able to diversify and be able to offer more. But definitely timing, I feel like, for my patients when is it a good time? And my answer to timing is what is bothering you? And then we can ask on a scale of 0 to 10, how bad is this bothering you? That gives me a sense of something that you want to fix today or something that we can push out to 6 months or a year. Is there an event that is up and coming? Like, why now? Why today? You know?
Yeah.
And some of them are very honest. Oh, somebody made a comment that I always look mean, and I'm not mean. I'm just frowning all the time. And it's not your fault. You're not even aware of your body expression. She's not mean, but it's like those 11 lines, that's my number one complaint.
Really?
Yes, because it kind of makes people look like they're frowning.
And they're not.
They're not. They just feel tense and
they just did a whole lot of frowning. They did a whole lot of frowning to get the 11 lines.
Some people are not even aware they're frowning. That's the thing.
They're focused. They're working away at their computer, at their desk.
And they're thinking. That's your thinking phase, And so when it comes to when can I start injectable, I say look at your genetics. If your mom, your dad is aging, and what are you seeing? If the 11s are kind of like etched in, that means more than likely that's how you are going to age ethnicity-wise and your genetics. So if you want to do preventative Botox for the 11s, hey, you know what? I just want people to look and feel good. And that's the bottom line. As long as you feel in your body and you're connected and you feel well, I truly believe when people look good, they feel good and they do good. So
I agree.
It's all good. Yeah. Any questions for me?
No, I agree with you. I do. I feel like that I get that a lot as well from my patients. What would you say? I do have one question for you.
Yes.
What would you say the most common area that people do come in about for concerns with something that tox would treat would be the 11s?
11s is number one, and it depends. I have seen patients who are more looking at the crow's feet. Like they don't like them. Yeah. Personally, I don't mind a little crow's feet because I feel like that's my expression. I'm very expressive. So I like a little crow's feet, but you listen to your patients and solve. If there's a solution for their chief complaint, this is a medical practice. So you look at the chief complaint and you put together a treatment plan and to gauge and see what the tools that we have in the box. And one other question that a lot of women see when you look at the mirror is the under eye. Make them look tired or it's puffy. And that's one area that we can certainly address if it's a Botox problem, if it's a filler, or add even a candidate for filler in the under eye. It's an area that is like very temperamental based on your body, underlining swelling, immune system issues. So good assessment, good patient history taking, I feel like can let you rule out who can and cannot get certain aesthetic procedures. A lot of time educating and clarifying that what do you think you might need is actually a surgery thing. Like if the under eye is heavy bags, you don't want to add fillers there. So that's like how I tend to like address patients' concerns.
Let me ask you, do you have partners, just colleagues that you send your patients to if you know they need a facelift or if their concern is their nose or something like that? Do you have just like a Rolodex of
Absolutely,
no
I do.
Rolodex. No one has those anymore. Like a list
Referrals,
of yes.
like a list of doctors that and partners in the industry that you
Yes.
refer to. So I have actually have a great relationship with a couple of facial plastics, and I tell my patients, depending on the body part that you're looking to address, find us somebody who specializes in that. I mean, we only have one face, you know.
That's
So the cost of facelift varies drastically depending on where you are. And I will give them the highest, like the plastic surgeon that I see is like world renowned. And I say, follow him, look at his work. That give you a sense of ideal and then begin to consult. I always recommend that you consult at least 2 or 3 different doctors before you make a decision
right.
and be comfortable with that. But yeah, I do have relationships with colleagues that I refer to in the area, and if they want to travel, that's totally good too. Depending, so I always get a feel of when they think they would need it, and then guide them. And that way, we can also talk about when do we stop fillers before your facelift. So I have a whole process to say, if you're looking to do a facelift, are you looking at 2 or 3 or 5 years plan? Most facelift last about 10 years. So,
wow.
Yeah, coaching your patients is a big deal. But I am actually having a date to go to the back office of a plastic surgeon. Yeah, out by Palo Alto. So I'm really excited about that because eventually, as an injector, you look at the face and you look at the skin from a different angle. And so I would like to be able to come back and have another session and talk about when we peel off the skin layer by layer. I mean, I did do anatomy and cadaver dissection course, which I think is instrumental, changed the way I practice the second time. But being in surgery room, like I specialize in the face. So like being in a surgical room where they peel the skin off, and if they're doing just a skin tightening or they're doing what they call the smash, they're moving, or when they're even going deeper, and be able to look in real time and look at especially the nerves where people come and say you don't feel your face for a while. I would like to be able to guide my patients through the recovery process. So yeah,
Wow.
I do have colleagues in the industry that I look up to for things that injectables cannot do.
Right. Yes. Okay, good. I was wondering.
Yeah. Could you discuss any memorable stories or transformation stories from your practice?
Yes. So I have this one lovely patient who really was, I was coming to the office one day and I wasn't even in the building yet. I just had my bag and my coffee and I'm going through the parking lot. And this lady, she was like, hey, excuse me, are you going in there? I said, yes, we open in like an hour. Can I help you? And she says, I need your help right now. I cannot wait. I've been in the parking lot for 2 hours. And I
Wow.
said, why? Why have you been in the parking lot for 2 hours? I said, come on in. So she comes in and she sits down. She was literally at her wit's end that morning. Her labs had resulted from her physician, her yearly labs for her physical, and everything was up. Her cholesterol was up, her A1C was up, everything, all the markers were up.
Wow.
And she was like, if I don't get this weight under control, it's going to kill me. And today is the day that I need you to help me. like lose this weight
Wow.
today. And I said, oh my goodness. I was like, you ran across the parking lot.
That's
Yeah. And so she joined my program. She lost like 60 something pounds. And she tells me all the time, she was like, you changed my life. You saved my life. She never thought that she was going to be able to lose the weight. She lost both of her parents to obesity related diseases.
wow.
Yes, and she was already on several medications for her blood pressure, and she was just trending to where her parents were,
Wow.
which is why it was so fearful for her that morning when she
Mhm.
got her labs back. She even was waving them to me when I was coming across the
Wow.
parking lot, some paper, and I
Uh-huh.
didn't know that's what that was. So, yes, we're leaning into aesthetics right now, but again, that is why everything that I do is definitely like, what is it that I can help this person sitting in front of me accomplish to
Yes.
feel and look
Yes.
their best? If it's weight loss, great. If
Uh-huh.
there's a Crohn's patient and they have inflammation and they need to
Mm.
be on an IV hydration
Mhm.
regimen, or someone else that has like chronic issues with whatever it is,
Absorption.
yeah, absorption issues.
Yeah.
I have
Yeah.
several bariatric
Yeah.
patients with malabsorption, so different things like that. But whatever it is they need, I want to be able to help facilitate that, and that exchange between she and I, which she didn't think it was possible that day because she had lost all hope.
Yes.
And she really thought that she was looking at, the end of her life because everything was going left for her, to be able to restore that belief for her and herself and facilitate the process with me and my team for her to change the relationship with food, start on a medication that she felt safe and comfortable and knowledgeable about, be able to start moving her body
Wow.
again, hire a personal trainer, like all of these different things
Wow.
so it can literally save her life was one of the most memorable experiences. I have so many others, but that was the most memorable because I remember when she hit her goal of
Uh-huh.
65 pounds, she danced out of my
Oh
office.
my
She just danced
goodness.
out of my office, and I'll never forget that walk. She was happy. Yeah,
See,
she came in walking slow as a snail, head buried in her chest, papers waving in my face. But 6 months later,
uh-huh.
she danced out of the office at her goal. That's life changing.
That is so incredible. So now that we are into, both you and I are primary care nurse
We
practitioners,
are.
and we're going more into medicine now. And as practitioners in medicine, where we see patients in clinic who normally have obesity and diabetes and hypertension, and that's what we treated
Mhm.
at the forefront of primary care, and you came into aesthetics. And I feel like having access to where she literally sat in your parking lot looking for you.
Mhm.
There are patients looking for connection, somebody to be their cheerleader, somebody. Walking to a doctor's office is so intimidating. I mean, having to call, make an appointment.
It is.
Look at the problem that you just solved by just being there
Mhm.
and having a location and somebody just waiting for you to be like, save me. Like, this is like,
Yeah. It's just interesting. I mean, it
that
just
give me
some.
goosebumps.
Yeah, I was gonna say sometimes it just gives me chills because it happens. It does happen, and then they refer friends, and their friends refer friends, and people tell me all the time how I changed their life and how my practice has changed their life. Not me
Oh,
as a person because I'm a vessel.
of course.
And but my practice and what I've put together
Uh-huh.
has helped them feel good and look good.
Wow.
And so yes, I'm very very honored to be able to use my clinical knowledge as a family nurse practitioner to treat holistically, to treat all encompassing. And so yeah, it's quite interesting.
That's so crazy how nursing is the number one trusted profession.
Yes.
And I was at a party. It's Christmas season anyway, but a patient tripped and fell, and I was right there. And I'm like, just the nursing in me just jumped in, and you can help it. And
Yes.
to have a license that credentials you and makes you a pillar in a community where patients can. I love nursing education. Be able to assess, diagnose, and treat, and recommend and follow up. It, it's such a huge opportunity in nursing education that patients trust us.
I
They
agree.
just do. I mean, my practice has grown significantly because 90% of word of mouth.
That's
I mean, we
amazing.
work hard, but when somebody already recommends a family member, a friend, or a coworker, it's done.
It's done because they are going to listen to their coworker, their friend, their cousin, whoever. They're going to listen to them. So congratulations on that.
Thank you.
It's so important. Word of mouth is major. That means you're doing something good. That means you're helping someone and they want to share you. It's like a gift almost.
Absolutely.
Giving you to someone else is a gift to the other person and also a gift to you. It expands your practice and allows you to help other individuals. And then it's a gift to the other person for them to be able to have the same experience or similar experience of what, their loved one had.
Yeah.
That's important.
No, it is building connections for sure. I feel like this business, this leaning into this industry as a clinician has really changed the way it made me a better practitioner because I'm not just looking at patients from, I just saw in the hospital for heart attack. I'm heavy cardiac background. I was a telenurse for a long time. Spent 16 years in a hospital, acute care before I went into aesthetics and in primary care. So having seen patients in the hospital and then now that I'm on the outpatient and even from primary care to aesthetics, it's like, I mean, having implemented a weight loss program for us with semaglutide slash Ozempic has changed our practice. It's brought me back to primary care to looking at patients from different angles and being able to help them and guide them through the process. So, yeah,
Yes.
yeah,
Oh,
it's
that's
super
great.
exciting. Super exciting. Um,
We have so many opportunities as family nurse practitioners. So many opportunities.
it's exciting because the laws are changing from state to state. It's exciting just to be part of a movement that is filling in a gap
For sure.
of where people could not reach and have access to services.
Mhm.
And when your insurance company denies your medication, like these patients are coming.
Yes. They're like, the insurance won't pay for it, but I will because they want it. They want to help decrease their inflammation. They want to lose a couple pounds. They want to decrease their risk of heart attack and stroke and everything else that comes along with being overweight for so long. So, yeah.
So tell me a little bit about your weight loss program because I do. You came here to level up on injectables, but your background has been more like wellness and weight loss. And I think one of the times that we have spoken in the past when we connected was the fact that you had been doing semaglutide much longer. So tell me a little bit about your experience and where that's going. You think it's here to stay? What do you think?
That's a good question. I'm not sure if it's here to stay. I
What makes you think that?
Well, as long as it's on, I mean, maybe. I feel like maybe, because right now people have access to the brand, those that can get it approved through their insurance. And then other people have access to the generic. And so for me, the generic is still on the FDA approved short list. But if that changes, then I feel like that's going to change the way that people have access to the generic, which may affect, a lot of practices that if your practice is heavy in weight loss. So I feel like that's why it's very important to just have your practice be broad in several things, not heavy in one thing, because at the end of the day, we're clinicians and everything that we do is going to be governed by by agencies. So these agencies can decide to change the guidelines at any time they feel like it. And we're also business women. So we need to make sure that we're always thinking about how those potential changes can affect the business. So that's why I'm like, I don't know. It may not. But my practice, we like I said, we started with IV hydration and vitamin injections, and then I did have a lot of patients that were extremely overweight, hard sticks, just not taking care of their health. They had all these other comorbidities, things like that. And I said, I probably should be adding on weight loss because I'm a family nurse practitioner. I see them, they tell me about their labs, but
Right.
I say to them, what is your primary doing or trying to
Right.
help you do for your weight? Oh, nothing. They told me that to eat less, walk more, or something like that. I'm like, that's it. The biggest issue that I have with a lot of primary care is that you can't just tell someone to eat less and walk more because there's so many things that go into being overweight. There's a lot of things that are engraved in some of us, depending on your ethnicity. You
Absolutely.
cannot leave the table without the food being gone from the plate. You have to eat
Absolutely.
exactly what you were served, waste not, want not, all
Right.
of these different things. And these things are engraved in your patients, whether you know it or not. And so the 10 minutes that you have with them, the answer cannot be eat less, move more. You
Yes.
have to kind of teach people about their relationship with food. And
Yes.
so when I decided to have a part of my practice be weight loss, and it's not just semaglutide or Manjaro or Ozempic or tirzepatide that we do. We also do oral medications. We do some peptides, and
Oh.
and so when I decided to do all of that, I wanted to make sure that it wasn't just me giving a prescription and having them go
Right.
and me order it or them to pick it up from the pharmacy. I want to teach them about their relationship with food. I want to talk to them about macros and intake and output and moving their body and calories. Like, what is a calorie? A lot of people don't even know. They look on the food label on the back of the label and they
That's
see
correct.
120. This, if I eat this, it's 120 calories. But
But how many
for how
servings?
many servings?
Right.
And what does that mean to the body?
Yes.
What do you have to do to burn that? So all of that. So our program is we call it total body transformation. So that's the name of
Oh.
the program, and they can do 8 weeks or they can do 12 weeks.
Okay.
Some people, and we sometimes we have like a 20-pound shred down or something
Okay.
like that, or something
I
that's
like
just
your
like,
packaging.
yeah, something like that. So they can do little short things if they want to. But the ultimate goal is to educate them so they leave lighter
Uh-huh.
and well educated about food, how medications work, the benefits, things like
Wow.
that. So it's definitely more on the family practice side of things,
Uh-huh.
but it's available to them.
That's amazing.
Yeah.
That's amazing. We are on our month 6,
Wow.
and yeah, great results, great results. But we've definitely struggled with the shortage.
Mhm.
The Pharmacy Board of California, access is huge, and we will get a vendor, and then a month later they said we can ship to California,
Mm.
and then we lost it. Then we're on the hunt again. So we right now stock the Ozempic brand name, a little bit pricey side. It's hard for people to afford that kind of money,
Yeah.
but when we hold them accountable and we know we are supporting you, I feel like, but we're taking it 1 month at a time. Whether we will continue to have access, we don't know. But for now, we have a good vendor, and we're actually looking to roll out a New Year's weight loss or fitness or wellness packages.
Nice. Nice.
Yeah,
That's going to be
yeah,
so beneficial. Because
yes,
the new year, everybody's like, new year, new me, New Year's resolutions.
yeah, yeah.
Mhm.
So, how do you balance achieving aesthetic goals and maintaining a natural look in your patients?
So for me, I always I can't do overdone. I
Yes,
can't do
that's
overdone.
your stance.
That's my stance. That's just
Yeah,
it. And I am not afraid to tell my patients no.
yeah.
And they also know I'm going to be very honest with them.
Mhm.
And so I tell them, less is more, and we'll
Uh-huh.
start here. We can always put more in, but once it's
Yes.
in, then you have to go through a process
So,
to get it out. So let's just be conservative. They
mhm.
appreciate that. They really
Yes.
do. So that's how I do it. Just maintain a natural approach by just
Mhm.
doing at least minimal as possible. So when
Right.
they leave, they're like, okay, I see I see something. I see a
Right.
difference, but they're not going to wake up tomorrow regretting
Like, what did I
what did I
do?
do? Because you have to
Yeah.
remember these people, the patients are, they still have to look in the mirror every day. And you
Yes.
don't want them to look in the mirror regretting their decision and then also putting your name with their regret.
No, not just that. They spent a lot of
And they
money.
spend a lot of money.
Yeah.
And I don't
Yeah.
know. I mean, I don't even worry about, I'm in business to, to be in business.
We have to survive. Yeah.
Exactly. But I don't lead my consultations with a dollar because the money's
I
going to
like
come.
that.
The money's going to come. For us, it's always been purpose over paycheck. We say that every
Wow.
week in our team meetings. And that has actually, that mindset and that approach has propelled our practice in 3 years. A lot of people don't have profitable and sustainable businesses. Mine is. And so I don't worry about, leading with so much of the sale. I
Wow.
lead with the transformation that my patient came to achieve and I
Uh-huh.
help them get there. And I have a patient for life.
Mind blown.
Yeah.
Mind blown. I will actually, since you're going to be here with us this week, I think I'm going to have you share that in our team huddle tomorrow.
Yeah.
I mean, purpose over, how do
Paycheck.
you say that
Purpose
again?
over paycheck.
Purpose over
The money's
paycheck.
going to come. It's going to come. If you do a
I
good
love
job,
that.
if you help people reach their goals, if you actually partner with them in the treatment room, which is what we do, and create a plan together, I'm leading. I'm the clinician, so I'm going to lead.
Wow.
But I also take into consideration of what my patient is there for, what I feel like they can handle, what I know that they can't. Some
Yes.
people just sit down there like, do whatever you want. I'm just like, well, hold on.
No.
Hold
That's,
on.
yes. Yes.
Yes, so
Yes.
purpose before paycheck every day.
I love
And
that.
it's leading
I
me.
love
It's
that.
leading me. It's leading me in my team and it's magical. So I'm gonna stay where I am.
Wow.
Yeah.
I think I've been doing that subconsciously,
Yes.
um, without even knowing that that's what I've been doing.
Mhm.
And you just put a word to that, because the aesthetic services prices vary quite a
Oh
bit,
yeah.
from a block, this block to block, and people ask me, how are you able to afford these prices? And I'm like, I just don't feel like I need, money is good, but it will come.
It'll come.
Yeah, yeah,
It'll come.
it'll come. Yeah, you just have to do right by your
That's
patients.
right. Because they're gonna send
Yeah,
you more. You take care of one, they're gonna send you 10.
that's exciting. Can you discuss some collaboration or communication between aesthetic injectors and other healthcare professionals?
Yes, so we in our area we have a few different professionals, healthcare professionals that we actually collaborate with. They'll send us clients, we'll send them
Nice.
clients, because ultimately anyone who comes into my practice is my patient, and
Right.
so I really want to send them to those who are the best, and so I seek that out in
Uh-huh.
my community, and those are the people that I send my patients to. The best chiropractor, the best massage therapist, the best dentist, the best gym, the best
Wow.
everything. Um,
How did you
yeah,
did you just walk up to them and be like, let's partner up? Tell me about how you get to
I
that.
did. So I'm a researcher. Just by nature. I really like to just learn things and I like to dig into things and just kind of figure out a lot of stuff. And so for me, we have over 150 five-star Google reviews.
Wow.
And that's just on Google, but we have other reviews, other different places,
That's
Facebook, Instagram, different places. And for me, I look for my practice
uh-huh.
standard in other industries. So I look for the massage therapist that has the best Google reviews. I look for the
Wow.
dentist that goes above and beyond. And I actually go there. I actually go to those places and I become a patient before I send my patients there. I spend my
Wow.
money there and I get the experience. I want to know if the experience is going to be exactly what the reviews say it is, or if
Wow.
they just hire someone to do all of the reviews. because people do that too. And
That's
I spend my money. I go and I found the best myofascial release specialist because I have
wow.
patients that have like muscle issues. The
Right.
best chiropractor. I spent a few sessions to go there before I started referring patients, and then I tell them after I've been there a couple of times, I say, I'm a nurse practitioner. I own this business here, and would you like to collaborate? I can send you people. You've been taking good care of me. I trust my patients to come here. And then they say,
Wow.
"Oh, I didn't know you were a nurse practitioner. I want to know how they treat me as a patient before they even know what it is that I do, before they even know that
Wow.
I have a practice around the corner." And so that's what I do. The dentist that I go to is out of
Uh-huh.
network for me. Yeah,
Wow.
so I that is what I do, and that's what I do for my people, and my patients, and it's important because I want them to have the best. They deserve that.
Wow. That's such a good partnering with more intentional.
Yes.
Like you're very intentional in your strategies.
Yes, I try to be because and then also I'm really big about just my business and then my own how how I don't want the patients to just think I'm just sending them anywhere. And because have you ever had someone give you a referral and then you go there and you have a different experience than they had, and then
Absolutely.
you're like, I don't know, so you don't want another referral from that person because you're like, I don't really know. Last time I went here, and you know.
I have been referred to an office and I walked in and I felt like they either didn't want my business or didn't want to see me for whatever reason. And I'm like, so the person who referred me actually thought that's great that you actually get to experience before you send your patients in there.
Mhm.
So tell me a little bit about your background before you became a nurse.
So my back, like way before became a nurse. Yeah,
Yeah.
so way before I became a nurse, I was a stay-at-home wife, and for income, I actually had a in-home childcare center
Uh-huh.
inside my home. It was built to the home, and I did that
Excellent.
for about 3 years. I love
Uh-huh.
kids. I'm a people person,
Uh-huh.
and so I just love to nurture and care and all of that with whatever it is that I'm doing.
Wow.
And so that's what I did before I became a nurse. I actually went to nursing school while I was still in high school for a little bit,
Wow.
LPN school. And I decided to get married with 6 months left in the program.
Oh,
And I didn't
wow.
finish the program. And I ended up moving. So I was a military wife. I ended up moving, and that changed everything. But when I was
Right.
there, I said, let me do my CNA. And so I did my CNA program while I was still doing the
Wow.
child care. And I was a CNA for 15 years before I became a nurse.
That's wild.
Yes. Yeah, so many different, I could have been an LPN for what, I don't know, 20 something years by now. But yeah, in high school. I actually was in the LPN program, almost done.
Wow.
Yeah.
So did you work as a nurse before you became a nurse practitioner?
I did. I did. I worked as a
Okay.
nurse for about 3.5, 4 years before I became a nurse practitioner. And
Excellent.
it was more like a little over 3.5 years
Excellent.
before I became an NP. But I always knew
Oh,
I wanted to be an NP. Um, I just I just wasn't sure if I was going to be going back to school for it or what. My background is in emergency medicine, so that's where my
excellent.
nursing started as an official nurse, as an RN.
Uh-huh.
But as a CNA, I worked for 5 years on the spinal cord injury unit at the VA hospital. Yeah,
Wow.
5 whole years at the VA. And then I've also worked cardiology units, different things like that. So that was my nursing assistant and patient care tech experience. But as
Uh-huh.
a nurse, I did the residency program at Hopkins, and I
Wow.
graduated from that. And then I was worked in the ER for some time, and then COVID hit. Yeah.
Wow.
Yep.
That's
Yes,
amazing.
thank
That's
you.
I did not know that. So then there's a huge transition between nursing and business.
Yes.
Tell me about your journey.
Oh, my journey between nursing and business is interesting because the business.
We're bridging the
Yes,
gaps.
yes, we're definitely bridging the gaps. You got to connect it. There's a bridge for sure, and sometimes you need someone's hand to hold as you walk over the bridge. But yes, it has been quite interesting because we are used to. Um, the business side being taken care of by other people. We just kind of show up to do the nursing work. But
Yes.
when you're a nurse in business, you have to do your nursing and you have to make sure that you're running the business,
Yes.
growing the business, expanding the business. We don't have a business degree. And so these things are learned through trial and error. These things are learned through hiring experts. I have a team.
Awesome.
I have a team of experts that help me lead my business that specialize in what they specialize in. So my
Right.
CPA, my accountant, my legal team, all of them
Uh-huh.
help me. Business advisor help me, get the business side of things.
Yes.
But I feel like, you have to learn those things. So you definitely have to bridge the gap. And one thing, like mentioned earlier, is I am a huge, I'm just a learning type of person. I
Okay.
like to get knowledge. So I read a lot when it comes to business things. I watch podcasts. I listen to audiobooks and things like that. So that's how I learned to market, brand
Mhm.
my business, just different things like that, just through seeking the knowledge and hiring the experts. But
Wow.
when anybody that I'm sitting down with,
Uh-huh.
I know a little bit about what they know a lot about. And that's just because I've
Okay.
already done my homework of
Right.
learning what it is that I need from them. So
Uh-huh.
they just can't always pull the wool over my eyes. Cause in
You are very wise.
yeah, cause in the beginning when I first started this business, people would just tell me all these things, and I'm like, "Oh, you would do all that for little old me?" And no. Then I said, "You know what? If you're gonna hire someone, you have
Uh-huh.
to know what it is that you need them to do, and then you have
Okay.
to know the expectation of what to ask. And if you don't look and study those things, you're not gonna know." So I would spend hours reading books, listening to podcasts, so things. So when
Yeah.
I come to the table to talk, because my business has to stroke the checks. So if I come to the table to talk, I'm
Uh-huh.
definitely going to be knowing a little something about what I'm talking about.
Wow.
Yes, but it takes time.
It takes time to put it all
It
together.
does.
And you still figuring it
I
out. Like
am
you still figuring it out.
every day.
It's every day you wake up and you're like, okay, there's some document that need to be filed with IRS and
Yes,
get a team to take care of it. That's
exactly.
it's so evolving. I mean, nursing and trending. And how do you feel about the whole movement of um, the market being saturated, like in aesthetics, like just so many people coming to aesthetics? How do you feel about that?
There is a lot of people coming into aesthetics. In some areas, I would say that a lot of people would say that the market is saturated. For me, and what I'm going to say, I say this all the time, so I don't want it to be perceived as it's cockiness because it's not. I do have a lot to learn, but I also have a lot that I know. So I always like to say that there's no competition when I'm in the game, and I mean that
Hmm.
because I'm me.
Wow.
No one else is going to do what I do. No one
Right.
else provides all encompassing care like I do, not in my area. So
Right.
I don't really worry about the who pops up across the street,
Right.
who's next door, because my patients, they're not going over there. They get
They
everything
know
they need.
you.
Right. So, and then new people that come in, they find us and they're like, I've been going somewhere and I've been looking for some place like this. So I think it's very important that people, I don't like when people get intimidated or think it's not enough room for them in the industry
Mhm.
to because it's everywhere and everyone's worried about, aging and just staying young and youthful and that they can't help people. No, you can help a lot of people because there's people for you, there's people for
Yes.
me. And anytime you have a new patient, it's a partnership, and they have to trust the person that they're partnering with, because
Right.
we're going to be together for a long time, and we're going to get older together.
That's
My
awesome.
patients tell me all the time, "Oh, I'm getting old. I'm getting old." I'm like, "Me too."
Let's do it.
Let's just do it together. We can just get old together. It's okay. So,
That's awesome.
yes. How do
That's
you feel
awesome.
about the market? Do you feel like it's saturated?
I don't think so. I think there's room. I think there's room for every angle of it. There's room for um growth. There's room for leadership. I mean, this is the one area where there's creativity. There's so many pieces and moving pieces, and you just have to. I feel like you have to know your strengths
Mhm.
and your weaknesses, and you need to know how to delegate. And I feel like for me, that has been like knowing when to delegate, and like it has cost me somewhat by not doing research
Mhm.
on referrals. So you ahead of me in terms of doing the research before you go in for the consultation. That way you know what you're getting, you know what to expect. I think I've been led in the wrong direction for a minute, and thank God I found a course correction. And but there's always room to grow. I do feel like we are just beginning. I don't think we've even tapped into all that nurses can bring to the table in terms of injectables and operating businesses. There's so many opportunities that I can close my eyes and give you 10 nursing business ideas. Um, so I just think we've not even scratched the surface. So
I agree.
yeah,
I agree.
yeah. And then the other thing is like nobody can be you are being you.
That's right.
Just being authentic, being authenticity. And people know when you're not being real, and people know when you cannot deliver, and just being truthful and just be honest. And most people will keep coming back to you because it's based on trust, you know.
Mhm.
That's what I love the most. Yeah, yeah.
Me too.
Um, let me see.
I will tell you, sometimes I have people just wanting to throw throw money at me in my chair of different things. They're like, "I want this and I want that and I need." I'm like, "But you don't need that, and you don't need this, and you
One
don't
step at
need
a
that."
time. One step at a time.
Yes, I'm like, "You don't need all of these things," and if you go to the wrong place, they will kindly sign you up for everything.
I have seen patients come with a treatment plan from other places, and I'm like, you're gonna have to move in with them. I mean,
Yes, you are. How are you gonna eat?
you're gonna be there every day, girlfriend.
Uh-huh.
Like, how are you gonna do that? So
Yes.
just being transparent and being and no, I don't mind being honest. Like you don't need it.
Mhm.
I mean, you don't need that laser. You're 22 years old.
You're okay.
This is the most beautiful you're gonna be.
Enjoy
So
it.
just trust me. It's the wrinkles will come when they
That's
do.
right. That's so
So,
fearful.
but I mean, it's a fine balance between insecurities.
Mhm. Oh,
And if somebody is truly insecure about something and it's in a way of them being who they are,
mhm.
I don't mind talking about it and making recommendation of and guiding them as to what and together we make a plan. So
Mhm.
yeah,
Mhm.
yeah, yeah. So
Oh,
yeah, Marsha, I know you have some questions for me.
yes.
Let's
So,
do it.
what do you think about injectors having a signature technique that is just unique to them? Maybe it's lips, maybe it's a full face, non-surgical rejuvenation. What do you think about that? Do you think that's necessary?
Great question. What we do is just like asking an artist to say, you never create the same pot. If you are clay, if you understand the analogy, like even if you're a painter, you never paint the same work twice.
True.
Somebody says something to effect of you never meet the same person twice, because from the moment I saw you a minute ago till now, you've watched a video, you've seen something that changed. And so asking that, having
a unique technique and branded it as somebody's lip technique. It's working for some people, and I'm open to learning. But as far as saying this is what I do best, I know what I can do. And so having another injector say this is what you should do for my results, every face is unique. You never approach the same face the same. So this is creativity. This is artistry. So between blending the science and the artistry, I feel like that's where the space of injectables, it does have its drawbacks. But I truly feel like having somebody's brand lip technique, each lip you look at is so different. So you cannot apply the same technique to every lip. So there are times when I combine techniques. So I will start with the Russian technique, or I will start with defining the borders and then focusing the next time we focus on filling in the body of the lips. So if I feel like, so looking at the anatomy and looking at today, and I'll tell the patient this, today we are going to focus on outlining your lips and creating the platform. And then next time we're going to focus on projection. And after we build the foundation, same thing with liquid facelift. If I feel like I'm combining different product line and services to give me that look, yes, you can combine sculpture and fillers. You always need Botox. I feel like that's like a staple. The difference between using a jawline. Jawline is so different on each person. So having somebody else's technique of doing the jawline might not apply to this specific anatomy.
Right.
Yeah, so there are techniques that I will learn from. I'm always open to learning and doing things differently, but I will combine techniques. So I'm not like, this is the gospel according to this injector, as opposed to living room. I always give myself room to create. I feel like I'm a creative. So yeah, that's how I feel about that.
Oh, that's good. That's a good way to look at it. Every face is unique. Every person is unique. They need a signature. They need the signature.
Their signature.
Yes. They need their signature procedure done for them. So let me ask you, what do you feel? This industry is growing very fast, and a lot of people are starting medical spas just because that's what they want to do. What do you think is, how do you think that's affecting the treatments that the patients are receiving? If you're just starting with no experience, even injecting patients before you just open a full medical spa, what do you think?
That's, so I have the Gifty politically correct version. And then I also have the gospel according to the boards. So the boards of every state have the guidelines. And in the state of California, where you live, there's a scope of practice. We are limited here on our scope of practice by having a collaborating or medical director, whatever you say that to be. So I do have a partner, a business partner who is an MD, medical director. And then any nurse by licensure legally in a state can inject. Who and what can they inject, and how much can they inject, and what training is required? I think I don't know. So I don't know unless anybody else know that there's a board. I know there's the cans, but I think instead of California, my understanding is if you are a registered nurse licensed to inject, you can inject. The question is from the moment you decide to be an injector to the day that somebody pronounces you start seeing patients. And do you start Botox? When do you do fillers? How much fillers do you do?
Right.
For you to, I don't think there is a guideline or a body that supervises that process. So by seeing another nurse open up a med spa and knowing them,
Mm-hmm.
working alongside them and knowing that you just took an overnight course
Mm-hmm.
and now you're I'm not the police, I'm not the judge of all that,
Right.
but I feel like we have a lot of work to do
Yes.
and a lot to learn and a lot of I don't want to say patience, but I say like being humble and knowing what you don't know, as opposed to wanting the sexy injector nurse show. It's
Yeah.
kind of somehow turned into a show in its way.
Yeah.
But that's what we hear, and we are learning as we go. But I think at the forefront is safety,
Mm-hmm.
and I truly feel like you have to do enough under somebody's supervision, somebody who has more experience than you, and you have to lean in when you choose to dive in into aesthetics. That I think we owe it to ourselves as a community to I know people come in for fun. There's a couple of injectors that I know have come out of retirement to open a med spa.
Right.
So of course their profit margin, we at the end of the day, we are business owners and we go in business to change lives and make a life for ourselves too. So I mean that's why you can get Botox for 7 units on the same street and get Botox for $14 on the same street.
Wow.
There's one maker of Botox brand, and that's Allergan.
Right.
So knowing that we both buy from the same vendor and the price difference is something that is yet to be. There's no. I don't think there's a straight answer for that. I just think we need to hold space to cautiously and hold each other accountable in terms of when is plastic surgery, when is Botox, when is fillers, how much fillers, when is laser, when do you hit you with CO2 laser versus chemical pills, when the board of dermatology, there's a lot of reference bodies that we look up to that I think as nurses, we look up to these governing bodies to guide us. But right now I feel like we're a little bit in uncharted territories and we will find out as we go. I mean, I'm going to AMSPA this year, so
Nice.
I like conferences. I do about 3 or 4 conferences each year. I am a continuous learner, so what I don't know, I lean in and I found out more. And I think we all, and because the laws are so different from state to state, we still like, we're trying to figure it out. And in the process, I just think safety has to be a priority.
Yes, for sure. I agree. I'm going to AmSpa too. I always like to learn.
Yes,
so that's good.
Super exciting. It's a good platform, I think.
Yes.
Look at me marketing for AmSpa.
I know. Let's see. Oh, so what? Let me see. What is your tip? Or what piece of advice could you give to a new injector that is new in the area? Maybe it's a little saturated in their area, but they want to stand out. They want to be unique. They want to be seen. What advice would you give them that could maybe help them, propel their practice?
If you're looking at growth, so you look at there's so many pieces of this business or this industry as a whole. And the more you learn, the more you're like, oh my gosh, I don't know enough. But you should know enough to know where to start from and where your strengths are. I think delivering results that is when the skill set is on point, then the work speaks for itself. So I feel like, oh my gosh, who did your lips? Or do you get Botox? Who does it? And the word will get along and around, and your name will go around by virtue of just being you. The second thing I would say is have a good
understanding of marketing strategy.
Mhm.
I happen to be very blessed to have a team that helped me with that in that support. Um, I also think that other tap into your resources. If you need a business partner, a business coach, a mentor, um, I mentorship. I truly believe in mentorship, and every time I go to a conference, I make connections and I make sure I touch base with um, within the state of California. I train with Dr. Chilcott, we share ideas. I talk to Dr. Horn on a regular basis. Partners with pharmacists
Mhm.
that you call on, and ancillary people who are a little bit ahead of you. I think it's good to have. I don't know who I read this. Where I read somewhere read that you should keep a pile. 30% of the people should be the people that you look up to,
Mhm.
and then 30% should be the people in your age bracket, kind of where you are in your stage in life,
Mhm.
and then the other 30 should be people who look up to you.
Mhm.
So the people that you look up to give you something to work for and towards and aim at. And then the people in your space, the same stage in life,
Mhm.
they make you feel good, like you're okay, you are where you need to be,
Right.
you know. And then the people behind you, if when you support them, it makes you feel good that you're able to give back and to people that look up to you. And then the other 10% is gonna be just diversify acquaintances and surrounding yourself with people who mean well for you
Mhm.
and will support you. And when you do trip and fall, which you are gonna trip and fall,
You are. Yes.
and if you are not tripping and falling, then it's all good.
Yes.
But have people around you that will support you when you trip and nurse you and say, "Hey, you're good. You got this." They're gonna throw you back in there and be your cheerleaders.
That's right. Dust your knees off a little bit. Just yes.
Throw back in there. Yes.
Okay. All right.
Yeah. Yeah.
I like that. What would you have done differently? What would you have done differently through this process? Like I know that you have a lot of experience, and but your company is still, on the newer end. But you all are expanding and growing pretty fast. So what would you have done differently?
Um, I am truly grateful for a family that really supports me in my endeavors, because this is not my first business. I've had my husband and I have had businesses in the past. I have been around businesses, so practically, I know how things work. But knowing what you don't know um, can cost you, and
Mhm.
so I would have, and I don't even know if there's a, when we know better, we do better.
Yes, for sure.
And I feel like nursing, opening business, and number one is safe, which I am a safe practitioner and I wear that badge proudly
Yeah.
because I did my critical care, I did my acute care portion, and I do feel like we owe it to ourselves as nurses. It's not required to work in a hospital to inject,
Mm-hmm.
but I feel like we owe it to ourselves to actually be in an environment where you you know the fundamentals, because we're not just doing lips. You're looking at anatomy. The
Right.
first time I saw an AVM, a atrial venous malformation on somebody's lip, I, because I'm a nurse practitioner, I know anomalies, and I expected an anomaly like a cleft palate,
Mm-hmm.
which it turned out the patient had had it reconstructed. And if I had injected into that AVM, you would have an occlusion.
Mm-hmm.
And so I think we owe it to ourselves to just be very cautious and have safety first.
Yeah.
But what do I've done differently is get the right legal
advice because nursing business is very new. It's relatively uncharted territories and the rules are evolving. Like the state of California now has nurse practitioners have authority to practice, but then that has some requirements that you have to do in order to get that process done and have to do it right. With your business structure, with your marketing, with contracts, with delegation. Who can a nurse practitioner delegate to? I still don't know if I can audit my RN's chart. I know I have to do the good faith for them.
Right.
So I don't know if I still can sign off their chart or my medical director can sign it off. And with every lawyer I ask, I get different questions,
They don't.
different
Yeah.
answers. So I just, you don't know till something comes up and hopefully you're practicing safely and you can produce a document and get your name cleared. And that's it.
Wow. Wow.
Yeah.
That's. I think that's very important. Thank you for sharing that. I'm sure it's going to help a lot of people.
Yeah. We're excited.
So let's talk. We were mentioning earlier about expanding perceptions and ethnic women and aging and weight loss. And um, what would you say is something that you've seen in the industry when it comes to the perception of aesthetics and ethnic backgrounds?
That's such a great question. So, a lot of diversity in the industry, and at AMSPA, they did do a panel interview of different ethnicities and expanding to LGBTQ and having a very welcoming space and having your practice mimic the community that you serve and what you stand for. So yeah, expanding perception in ethnic women, I think, is something that we have to define beauty our own way.
Yes.
And that is something that I always like when I'm consulting. I look at the patients in the eye and I say, you have beautiful eyes. How can we make that stand out? Your cheeks, they're so beautiful. They keep you youthful. But what else can we do? So ethnically, I feel like we still have some work to do surrounding shame and guilt, especially when the beauty standard is very much how do you say that unique. And I feel like defining your own beauty and what makes you beautiful is the key, and tapping into the strength of your patient that you're looking at. We have to make it a little bit more. I do see some patients who come in during the holidays and be like, no, just easy a little bit because I don't want to be judged. I'm saying my mother-in-law. And so there's a little bit of judgment and guilt and shame surrounding injectables or what is considered beautiful. And I feel like we are at the forefront of empowering women and men to lean into what makes you beautiful.
Whatever is going to feel good for them.
Exactly. But definitely for ethnic women, I feel like we owe it to ourselves to ask for what we need rather than wait. And it's okay to feel vulnerable. That is something that you want to fix. And there's nothing wrong with that.
There's nothing wrong with that.
No.
I like that. There's nothing wrong.
No. And I tell patients what I do. I do get Botox. My lips are natural, but I have had fillers in my hands. I mean, I did the new Glow Skin Booster.
Oh yes. Do you like it?
I love it.
You can tell a difference?
I can tell because I am getting dull on my cheek right here. So last night when I put on my blush a little bit, it popped up a little bit.
Nice.
Yeah. And I'm not shy to tell patients what I've got done. And them knowing that I get my laser hair removal, which is life changing for me. Like no shave, Come on.
That's great.
No brainer.
Get your time back. Yeah.
Get your time back. So anything that I do that I feel like has changed my quality of life, I share it.
Yes. I like that. I like that. I think it also makes you very relatable to your patients when they know that you've had different things done too. You don't have to have everything, but
Of
different things done
course.
too. They're like, oh, how did it feel? Did you like it? Things like that. So that's good. Yeah. I was just wondering because I see that a lot in different ethnic backgrounds. Some, are very concerned. They have naturally thin lips and they want it to be fuller.
Do you know what I think is
What's
amazing?
that?
That this is the one industry that mothers are following their daughters.
Yes.
Like my daughter got Botox and she looked good. And I'm like, oh, I did it more than her. So I'm coming. So I think that is
Good.
something that is really cool to see daughters leading the way in the beauty industry
Mm-hmm.
and making it okay. Like, mom, get Botox. It's okay.
It's okay.
Like, it's fine. Nobody's going to die.
Right. Trust me.
It's all good.
Uh-huh.
All right. So we did talk a little bit about mentorship. And again, I'm a firm believer that this is creativity and it's an artistry and it's something that you're going to need to practice a lot to get good at it. And I feel like having a mentor on the business side as well as on the skill side is critical to us being safe and doing good work and having good judgment. So who have you used as a mentor in the past?
So that's a really good question. I have Dr. Zolly Coffer is a great physician in the Baltimore area. So I've definitely used him as a mentor when I was starting to practice out, and I still call or text or, reach out to him if I need something, and he reaches back out, and, he's wonderful. He's a wonderful resource.
That's awesome.
And he's a primary. And then he's a pediatrician, but he treats the whole community. It's interesting.
Wow.
Yes.
Wow.
So, yes. But
That's cool.
he's really, really good. Ernest Fannell Williams. She's my attorney, but she's also a mentor to me because she has really helped the success in my business and helped guide me. And for us, one of our biggest concerns was always making sure that we had legal down.
Yes.
Just because, people, this is a litigious
It is.
stage in the world that we live in, and
Yes.
people just want to sue all the time. And even though we cross our T's and dot our I's, you always have to make sure that you have legal to run things by and make sure that you got that covered. So she turned into more than just our attorney, and that's a wonderful relationship, and that we definitely value. And so she has helped us also on the business side of things, just guiding and helping with that. And when it comes to the aesthetic side of things, I've just done some one day type of behind the scenes with the different injectors, but never just a full on mentorship with an injector that's been in the industry. I hadn't had that. No.
I am honored to have you. I'm truly honored to have you. And again, Aesthetic Lab Training Academy, we pride ourselves in elevating the skill set that we are delivering and being able to be consciously inject and safely and cost effective premium care. I feel like we owe it to ourselves to learn from the best and lead, because at each moment you are leading and also being led at the same time.
Oh yeah.
And having that sense of I have mentors and I believe in mentorship, and that's why I have a mentorship program, because this is not something that you want to do in isolation.
Right.
And building a network. So again, if you have any questions regarding Aesthetic Lab mentorship program and shadowing, please give us a call and DM, and I'll be more than happy to connect with you. And thank you, Marsha. Thank you.
Thank you for having me. It's been a great experience.